Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Thank you so much for viewing today's episode of Dr. Ozello's Sports Medicine Report. Today I am going to cover cervical disc herniation and cervical disc bulge. This is part 2 of this presentation. Last week I had part 1 where I talked about the anatomy and the nomenclature, and I basically explained what a disc herniation was. I described a disc herniation and a disc bulge. Today I'm going to speak about the symptoms. I'm going to speak about what you can do to help to prevent this injury, what you can do for professional care, and what you can do for self-care. Also, I'm going to speak a little bit about ergonomics, prevention, all those types of things. Again, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. Please remember, if you have suffered an injury and you think you have a cervical disc herniation or cervical disc bulge, or if you're just having any type of severe pain in the neck or the upper extremities, please see a medical professional. If you are having chest pain, please go to the emergency room. But please do yourself a favor and see a medical professional if you think you have a disc herniation. Watching this video does not take the place of seeing a medical professional. The symptoms of a disc herniation and a disc bulge can be quite severe. I mean, they can be extremely intense. These symptoms are usually sharp-shooting shock-like pain, numbness, tingling, burning. These symptoms can begin in the cervical spine and go all the way down the upper extremity. Now, the symptoms, they can be exacerbated by the slightest movement or the slightest activity. Again, like I spoke about in the first video, the injury can be an acute injury where it happens from an impact and those symptoms begin almost immediately, or it can be a chronic issue where the symptoms begin insidiously. Either way, this is a serious medical condition. When we speak about that sharp-shooting shock-like pain, that is what is called radicular pain or radicular symptoms. And the numbness, tingling, burning, that is what's called paresthesia in medical terminology. So you may see those terms written if you are reading an article or if you are reading a report on your condition or someone else's condition. A disc herniation and disc bulge can also cause other symptoms. These symptoms are usually limited pain-free range of motion in the cervical spine, in the shoulder, and in the upper extremity. They can be weakness and atrophy if the impingement on the nerve is long-standing. Anytime there's compression, impingement, or irritation of the nerve, there's going to be weakness in the muscles that nerve irritates. If that irritation or compression is long-standing, there can be atrophy. Atrophy is medical terminology for shrinking of the muscle size. So you want to remember those symptoms. Again, limited pain-free range of motion. There may be an antalgic position. I mentioned this one before. An antalgic position is a body position that you assume because it lessens more pain. When we speak about a cervical disc herniation, an antalgic position may be leaning the head to the opposite side, and that may help to lessen the symptoms. It may be turning the head to the opposite side. It may be turning the head to the same size, but that is to the same side. That is what's called an antalgic position. Antalgic position is a position that lessens the intensity of the symptoms. Another symptom of a disc herniation or a disc bulge in the cervical spine is a alteration of the deep tendon reflexes. Now, when you go and get your examination, the doctor is going to do your reflexes, so there may be a decrease or an increase in the normal deep tendon reflexes in the upper extremity. Other symptoms include slow and guarded motion. You may be needing to move very slowly to help to lessen the intensity of the symptoms. Also, there may be tightness in the muscles. This is what's called muscle guarding or muscle splinting. Muscle guarding or muscle splinting is the body's defense mechanism to help to prevent you from moving in a position that intensifies the symptoms or increases the impingement. Basically, it is helping to prevent you from moving in a position that's going to create more pain. A disc bulge or a disc herniation causes impingement or compression or irritation of the nerve root. So these conditions are nerve impingement conditions. Whenever there is a nerve impingement condition, you have to realize those symptoms can be whatever area that nerve goes to. So if it is lower in the cervical spine compared to it being in the middle part of the cervical spine, those symptoms are going to be located in a different area, not only in the cervical spine, but in the shoulder and down into the upper extremity. So the location of these symptoms obviously depends on which nerve is being compressed with the disc herniation. So the location of the disc herniation is going to determine where the symptoms are located. The most common level of involvement of the cervical spinal nerve roots of a disc herniation are cervical spinal nerve roots C6 and C7. So these are located in the lower part of the cervical spine, and again, those are the two most common areas where a disc herniation occurs, causing impingement on those nerve roots. Again, it's cervical nerve roots C6 and C7. If you have suffered an injury or you think you have a cervical disc herniation, do not hesitate. Take action immediately and see a medical professional. As a doctor of chiropractic, I have treated disc herniations and disc bulges. I've treated plenty of them throughout the years. So please see a medical professional. You want to get the proper evaluation. The evaluation is going to consist of a consultation and an examination, most likely x-rays and an MRI. An x-ray is going to show us the bone. It's going to help to rule out if there are any fractures or dislocations. You'll also be able to see the disc space, and you'll also be able to see the neuroforamina. So we'll be able to see those spaces, which is extremely important. The MRI is going to show us the soft tissue. The MRI you'll actually be able to see the intervertebral disc. So it's very important to see a medical professional and get a proper evaluation. What the evaluation is going to do, it's going to give us information and allow us to give you the proper diagnosis. Now remember, the proper diagnosis is what's going to set you on your path to recovery. So please see a medical professional so that you get the proper diagnosis so you can be set on the proper path to rehabilitation. The treatment is going to consist of trying to eliminate the source of the symptoms, to take the compression or the irritation off that spinal nerve root. So please see a medical professional and get the proper evaluation. This is going to help with your treatment and is going to help with your self-treatment. Like I stated earlier, as a doctor of chiropractic, I have seen plenty of disc herniations and plenty of disc bulges throughout my career treating patients. This is a condition that chiropractic can help. In chiropractic, the main tool that we use is what's called a chiropractic adjustment. The chiropractic adjustment helps to restore proper skeletal motion, which helps to optimize nerve flow. Therefore, we're helping to remove the source of the symptoms. That's what we do as a doctor of chiropractic. After I do the proper evaluation and give you the proper diagnosis, my objective is to remove the source of the symptoms, and the chiropractic adjustment will help with that. I would do it to the cervical spine and the thoracic spine and work the entire chain, meaning the shoulders, may need to adjust the ribs, the elbow, the wrist, the hands, the fingers, whatever area throughout the entire chain that I feel needs to be adjusted, I will adjust that area. Now, obviously, in the very beginning, depending on the patient's symptoms and depending on the range of motion, because the range of motion may be very limited, the adjustment may be very mild, may be very light in the very beginning, and as the patient progresses, then we can get a little bit more aggressive with the treatment. I'm a big advocate of patient education. That's what these videos are all about. That's what Dr. Ozello's sports medicine is all about. I want to teach people how to help themselves. I want to educate these people. That's what I'm trying to do with Dr. Ozello's Sports Medicine Report, is provide patient education to everyone who is willing to watch. One thing that's extremely important is ergonomics. Ergonomics is your body positioning. when you are sleeping, when you are driving, when you are working, when you are on your cell phone, when you're using any type of electronics, you want to use proper body positioning. Do not let the chest come down like this. Do not let the shoulders roll forward. You want to try to be in a good position where your shoulders are back, your chest is open, your neck is not forward, your neck is in line with the spine. That is going to help you a great deal. Now, one thing that you want to remember is any type of exercise that you do or any position that you assume, it should help to decrease the symptoms. If any exercise that you're doing is evoking the symptoms or intensifying the symptoms, then you want to stop doing that exercise. You want to modify that exercise so it is working for you. Once you have gotten your evaluation and your diagnosis and you are getting your professional care, then you can start your self-treatment. Ask your doctor what you can do to help yourself, and the doctor is going to give you recommendations as to what corresponds to your examination findings. So it's extremely important. You can do stretching exercises, motion exercises, nerve slide exercises. These are all going to help you a great deal. And now, like I mentioned before, is please be very mindful of how these motions and these exercises make you feel. If they evoke symptoms or they intensify symptoms, you do not want to do that specific exercise or that specific motion. You may be doing a range of motion exercise and you want to work through a pain-free range of motion. That pain-free range of motion may be a half an inch to start with, and that's okay because motion is going to help you a great deal. So start with that half inch and it will gradually increase. Motion is the best medicine. I am a firm believer. If you watched part 1 of my video, I spoke about the intervertebral disc needs motion to help with the osmosis where the nutrients flow from the vertebrae above it and the vertebrae below it. So that's how the intervertebral disc gets fluid and gets nutrients, is through motion. So we want to move. Again, move through a pain-free range of motion. If a certain amount of motion elicits symptoms or intensifies your symptoms, then back off. Just do a little bit of motion. Do very mild, slow, static stretches. Back to the range of motion exercises. Those should all be done very slowly and very mildly. And then with the static stretching, again, move into the static stretch nice and slow. Hold a mild, comfortable stretch. When you are doing a static stretch, do it very lightly and very gradually. If it starts to elicit symptoms or make your symptoms worse, then back off on that stretch. And you only want to do these a couple times in the very beginning, and then as you are progressing, as you're feeling better, then you can do them more frequently. Nerve slide exercises are also something that you can do. You don't want to do too many of them at first. Nerve slides are non-resistance, non-exertion motion exercises, very precise motion exercises that can be done for the nerves in the brachial plexus and basically anywhere throughout the upper extremity. There's also nerve slides for the lower extremity, but what I'm talking about today is the cervical disc herniation. So the upper extremity nerve slides apply a little bit more, but you can perform those. I have videos of those. Go ahead and watch them. Perform those very, very lightly. Just start with a couple and then gradually build up. And again, just like I mentioned before, if these motions elicit symptoms or make your symptoms more intense, then you want to back off. But nerve slides are excellent exercises to perform. What a nerve slide does is it helps the nerve to move better between or in through the nerve. It helps to lessen areas of nerve encasement by scar tissue, because many times if there is a nerve impingement, scar tissue starts to form and it traps that nerve onto the muscle. Doing nerve slide exercises will help to free that nerve from that scar tissue. But you don't want to do too many. You don't want to irritate the nerves. So start with just a small number and gradually build up. You always want to listen to your body's signals while you're doing the exercise, after you're done doing the exercise, and even the next couple days. Write down everything that you have done, and this will help you to figure out what is working for you. It's very important. It's just like when you're working out and you have your training journal and you have your nutrition journal. It's the same type of thing. Call it your rehabilitation journal or your recovery journal. Write down everything that you're doing, all the motion exercises, all the stretches, all the nerve slides, and it's going to provide you with excellent feedback. Now, once you have progressed enough and you get your doctor's permission, then you could start doing strengthening exercises. The most important strengthening exercises are ones where you're working the muscles that are affected by the nerve that is being compressed or impinged in the disc herniation. You want to start very, very light. Do not try to start where you were before the injury occurred. Do not try to start where you were 5 years ago, or do not try to start where you were at the age of 21. I hope you're getting my point. You need to start at your current fitness level. Start at your current health level and gradually increase the intensity. No more than 10% a week. That is the best rule for gradually intensifying your recovery. Now that is a rule where we use it for if someone is trying to prevent an injury. So if you have an injury, you may want to do 10% or less. You may even want to do 5% a week. And it doesn't sound like much, but when we add it up, you think about 1 week, then 2 weeks, then 3 weeks, then 6 weeks, 12 weeks, there's going to be an increase, a very noticeable increase. But again, write down everything that you do. Pay very close attention to how your body is responding. A disc herniation and disc bulge is a very severe injury. It can be debilitating. I have seen people who had to change careers because of this injury. So you want to make sure that you get the proper professional evaluation, get the proper professional care, and get the proper self-treatment. Work together with your doctor. If you're seeing a doctor of chiropractic, communicate with your doctor. If you are working with another type of medical professional, communicate with them. Let them know what is working. Show them your journal that you're writing down everything and how your body is responding. Nutrition and supplementation is extremely important when you are recovering from any type of injury. The first thing you want to do is you want to make sure that you do not have any nutritional deficiencies in your diet. From there, you build upon that. You get yourself the proper amount of lean protein, you eat your healthy fats, and you get your carbohydrates. You want to make sure that you are supplying your body with the tools that it needs to recover. And then supplementation. There are different tests that you can get to see what supplements that you need, or you can just tell your medical professional what your symptoms are, and if they're very good with nutrition and supplementation, they'll be able to point you in the right direction. But you can do a hair tissue mineral analysis. That is great for looking at the minerals and telling you what is toxic, what is that toxic levels, what is that deficient levels, and giving you balances of those minerals. So that's something that you may want to look into. Also with the supplementation, you may want to do fish oils. Your omega-3 fatty acids are so important when we speak about recovery. So these are things that you want to keep in mind. Please eat properly. Eliminate any deficiencies and toxicities in your nutrition, and then supplement your nutrition with very good quality supplements. Find supplements that are derived from certified organic whole foods and work with a medical or fitness professional that knows a great deal about supplementation. Thanks everybody for watching today's episode of Dr. Ozello's Sports Medicine Report. I know I went over a great deal, and when you watch the first part of this video and then watch this video, there is a large amount of information, but this knowledge will be extremely helpful to you. First of all, you want to do everything you can to prevent this type of injury. Use proper lifting technique. Use proper technique when you are training, when you're running, when you're in your competitive sport, when you're working. Always be mindful of your proper body position. That's going to help to prevent this injury. Strengthen your neck and strengthen your mid-back. That's the cervical spine and thoracic spine. Make sure they're strong. Make sure all the surrounding structures are strong. The muscles in the shoulder, the muscle in the upper extremity, the chest muscles, the mid-back muscles, the ones that pull the shoulder blades back. You want to make sure that entire area is strong. Be very mindful of your body positioning, not only while you're sleeping, when you're driving, when you're working, but when you're training also. Be very mindful of how you are positioning your body and how you are using your body. So I want to say thank you very much for viewing today's episode of Dr. Ozello's Sports Medicine Report. Again, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can get additional information on the book. You could connect with me on other social media platforms. You could find links to numerous articles I have written, and you could find links to numerous videos that I have done. So please do yourself a favor, visit my website, championshipchiropractic.com. If you liked this video, please give me a thumbs up. Please feel free to leave any questions, comments, or suggestions in the comment section below. If you have feedback, please leave it in the comment section below. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. I have 2 weekly videos, 2 Minutes of Anatomy, and Dr. Ozello's Sports Medicine Report. Again, I want to thank you for viewing today's episode on cervical disc herniation and cervical disc bulge. This is a serious condition, so please do everything that you possibly can to prevent this condition. And if you are diagnosed with this condition, please do everything you can to recover. And always remember, train hard, train smart, utilize nutritional strategies that work for you, stay injury-free, and accomplish your goals.